Now, Kirsten, do you want us to read questions as they come in, or should we wait till the end?
No, we're gonna wait till the end for the questions.
Perfect.
So yes, mostly just keeping them organized. All right. Welcome everyone. We are going to go ahead and get started right away because we have a lot of information to cover in a not so very long period of time. So to get started, I want to just review the class structure. So this is part 1 of our menopause series. So there's going to be 3 separate classes. The first is today, and then we'll have another one next week on Thursday, same time. And then the week after that will be our third. Each class will have its own specific topics. So today we're going to be talking specifically about the brain hormone connection and kind of diving into truly what menopause is and how it works throughout our entire body. And so we'll talk about the stages, we'll talk about the symptoms and how it affects our bodies. And then next week, that's when we'll discuss how to manage our symptoms. So we'll talk about what the symptoms are today, but next week is where we'll talk about treatments and management through hormonal and non-hormonal therapies. And then the week after that, we'll talk about lifestyle and integrative health changes that we can make that will also help manage our menopause struggles. So with that being said, I promise I'm going to try and answer all of your questions to the best of my knowledge. However, I am not a doctor. I am not a neuropsychologist or a neurologist by any means, but I have done extensive research. I've read several books in preparation for this workshop. And so I will do my best to help prepare you and answer your questions. But please don't let the conversation we have here or over the next 2 weeks replace a conversation with your primary care doctor and your gynecologist. So that being said, let's talk about the author first. So, who is Lisa Mosconi? If you recognize this page, it might be because you joined us on our brain food workshop that we did last year. She is a phenomenal woman and has done so much for women and science. Just a little introduction to her. Dr. Mosconi grew up in Florence, Italy, and moved to New York City shortly after receiving her PhD. To understand her work and to ensure I don't miss anything, I'm just going to read a part of her bio because she is so impressive. Dr. Lisa Mosconi has a PhD and is an associate professor of neuroscience in neurology and radiology. She is director of the Alzheimer's Prevention Program at Weill Cornell Medicine, Newark Presbyterian Hospital. The program includes an NIH-funded Women's Brain Initiative, the award-winning Alzheimer's Prevention Clinic, and the newly launched Alzheimer's Prevention Clinical Trials Unit. Dr. Mosconi holds a PhD degree in neuroscience and nuclear medicine from the University of Florence, Italy. A world-renowned neuroscientist, she ranks in the top 1% of scientists over the past 20 years by official metrics. She's also recognized by the Times as one of the 17 most influential living female scientists and has been honored in L100 Women That Are Changing the World. Dr. Mosconi has been acclaimed as the Mona Lisa of neuroscience. She is author of the book Brain Food, which we discussed last year, the best-selling book, The XX Brain, and then the book that we're here to talk about today, which is New York Times best-selling book, The Menopause Brain. It came out last year, and it has already been translated into 7 languages with more coming. So if you want to learn more, I highly recommend visiting her website and, of course, reading the book and getting all of this information firsthand. Okay, so let's dive into menopause. First things first, I want you to know that you are not crazy. She says this over and over again in her book, but you are not crazy. menopause is a topic that is not well researched and is even less talked about. So every worry, every symptom you have, I promise are valid. You're not going crazy, and we're going to try and touch on as many of them as possible. Menopause typically hits somewhere between ages 30 and 60. I know it's a huge range, but it tells you just how complex this topic actually is. Many women feel that they wake up one morning and wonder if they are simply just losing their mind. The changes and onslaughts of symptoms can feel disorienting and confusing, and little is known about what to expect and how to proceed. It does not help that for the majority of history, menopause has been seen and has been treated like a disease. And once it was recognized as a stage of life that literally 100% of women who make up 50% of the population go through, Dr. Mosconi says, quote, it was pigeonholed as an issue with the ovaries and consigned to OBGYN territory, end quote. But anyone who is currently going through menopause or has gone through it knows that it feels like it has little to do with the ovaries and everything to do with everything else. And that is true. Menopause very much affects the brain, which in turn affects every other system in our body. So what is menopause? To get started, we're going to define some clinical definitions. Today's workshop will be the most technical of the 3 workshops, just because we really need to get a background on what is happening inside of our bodies. So premenopause is the whole reproductive period that happens before the menopause transition. Menopause transition is the time where the menstrual cycle becomes irregular and hormonal and clinical symptoms of menopause begin. Menopause is the ending of the menstrual cycle. Clinically speaking, this is the transition between, so when menopause is when the transition is complete. So it's 12 months after the final menstrual cycle is when you're considered in menopause. Perimenopause is the phase that starts towards the end of the menopause transition and continues into the first year after the final menstruation. Postmenopausal is the stage starting after the final menstrual cycle. But once again, you won't know if it's your final menstrual cycle until 12 months after that period. And so it's very much a range, and it is a transition. Okay, so on top of the different phases of menopause, there are also different types of menopause. And we're going to talk and define those as well, once again, to add just validity to everyone's experiences. So we have spontaneous or natural menopause. This is when the ovaries simply run out of egg cells and the production of estrogen and progesterone start to decline. Most women enter natural menopause between ages 49 and 52. Hold on, I'm just going to make sure everyone is muted. Okay. Thank you. Okay, so that is our natural menopause. Once again, most women enter into natural menopause between ages 49 and 52, but that range differs depending on a couple different factors, including genetics, ethnic background, and your geographical location, so the environment in which you're in. Premature menopause happens before age 40. Early menopause is when it happens before age 45. Induced menopause is menopause caused by the surgical removal of the ovaries or the discontinuation of function due to medical procedures such as radiation or chemotherapy. Surgical menopause is provoked by a surgical procedure such as removing the ovaries in the fallopian tubes, or a total hysterectomy, removing the ovaries, fallopian tubes, uterus, and cervix. Partial hysterectomies in which ovaries remain, or an ovarian cyst removal or endometrial ablations, those do not cause menopause, but they can affect blood flow to the ovaries, which can prompt menopausal symptoms at an earlier age. And then medicinal menopause is provoked by medical treatments for a variety of conditions. It can cause temporary or permanent damage to the ovaries. So this would be such as like radiation or chemo, estrogen blockers, often used in certain types of cancers, aromatase inhibitors, and medications that keep the ovaries from making estrogen and progesterone. So one of the most common questions we get is, well, how do I know what stage I'm in? And as frustrating as it might be, the answer is your symptoms. Symptoms are the first sign that you have entered perimenopause. So if you feel that your body is off or you're wondering if this is menopause, chances are it is. You're right in line in your thinking, especially if your periods have become erratic or even are just a few days off here or there. Okay, but Kirsten, I don't have my period because of X, Y, and Z. So how do I know what stage I'm in? Well, the good and bad news is that missing periods are not the only symptom. There are a whole host of other symptoms that can prompt you into knowing if you're headed towards menopause. A lot of questions that I've gotten preparing for this is, can I get a blood test to check my hormone levels? You can, but generally speaking, if you are a 47-year-old woman with irregular periods or a 58-year-old woman with no periods, a blood test is just not indicated. Instead, a complete medical examination by your gynecologist or your primary care physician is going to be your best bet to identify what stage you're in. However, if you're someone who does not have regular periods, whether due to medication, surgery, or other reasons, this is where labs can help. And I have up on the screen kind of our levels, but this is where it can get really tricky, because when they do your lab work, what's going to happen is your doctor is going to look at your levels of estrogen, your progesterone, your LH, your FSH, and your inhibin B. But as you can see, if you look on your screen, those are huge amounts of ranges. So for example, estradiol, which is your estrogen level, in your follicular phase, it can range from 12.4 to 233. And anywhere between there is normal. Ovulation, once again, a huge range. Luteal phase, huge range. And then postmenopause is just anything, right, less than 138. And so when you get your lab work done, it's not a true indication of which stage a woman is at, because your levels range depending on where you're at in your cycle. So especially for women who are in perimenopause, where the cycle is irregular and your hormones are fluctuating so much, lab work doesn't really indicate where you're at or even how much longer you have until you hit that final period. Also, hormonal contraception, such as the pill or an IUD, can even further affect the accuracy of the FSH test, which once again just complicates the lab work. So while yes, technically and in some cases lab work can be indicated, it's just not the best way to find out. And so unfortunately, once again, the number one indicator is your symptoms. So let's talk about your symptoms. There's a lot of symptoms, and a lot of people just mention them, on the get-go, but they don't really give you details. And there are so many. So similar to the saying that no two pregnancies are alike, no one experiences menopause exactly the same. Mothers and daughters may have similar experiences, and it can be an indicator of kind of what your experience is going to be like, depending on how your mother went through menopause. But even that, it can change, right? We talked about how there's genetic factors as well as environmental factors. So if you're not living where your mother was living when she went through menopause, that can affect your symptoms. So let's dive into the list of symptoms. This is not meant to scare you. It's simply meant to inform and prepare you, as well as help you know that you are not crazy. These are all symptoms, and they're not in your head, and they're worth exploring and trying to help mitigate. There are two different forms of symptoms. The one that you're seeing on the screen right now, these are somatic symptoms. Somatic symptoms are symptoms of the body that do not have a direct correlation to the neurological symptoms that we're going to discuss in a minute. So you can read on your screen, but I can go through some of these as well. So, right, we have changes in our period frequencies, vaginal dryness, painful intercourse, stress incontinence, overactive bladder, muscular changes that can manifest in joint pain and stiffness, muscle tension, muscle aches, breast soreness, breast swelling, loss of breast fullness, irregular heartbeat or heart palpitation, changes in body composition, breast soreness, I already said that, breast wellness. We have weight gain, slower metabolism, digestive issues, bloating, acid reflux, nausea, thinning hair, brittle nails, dry skin, itchiness, changes in body odor, changes in taste, dry or burning mouth, tinnitus, muffled hearing, sensitivity to noise, development of new allergies, bone frailty, which can lead to an increased risk of osteoporosis, and once again, changes in heart rate. So those are just some of the symptoms. But there's even more. So we also have these neurological symptoms. And these ones tend to be the ones we talk the most about. So these are things like your hot flashes, your changes in your body temperature. So not only the hot flashes, but maybe you get really cold all of a sudden. Changes in libido, changes in cognitive performance, changes in mood, sleep patterns, stress levels, dizzy spells, fatigue, headaches, migraines, depression, intense anxiety, panic attacks, electric shock sensations. Some women report literally feeling like they have an electric shock that starts at their feet and goes throughout their body, or sometimes it starts at their head and goes throughout their whole body. And then brain fog. So there are so many symptoms, and all of these symptoms are real, they're bothersome, and they deserve understanding and addressing. And so we want to make sure that we are recognizing these. But once again, right, these symptoms do not originate just in the ovaries, but instead they originate almost all of them in the brain. So we're going to talk about that. We're going to talk about how the ovaries and our brains are connected. So I know when I was reading this book, I don't know how I missed it in all of my biology classes, but there are actually 3 types of estrogen. And the XX brain runs on estrogen. So more and more research, and the research that Dr. Mosconi shows that time and time again, for females, our brains and the way that they're activated through our estrogen levels. Men's brains are activated through testosterone. So it's just the way that we are built, depending on our genetic code. And so there's for sure more conversation to be had on that topic, but for the sake of time, we're just going to focus right on the estrogen and the 3 different types. So the 3 different types are estradiol, estriol, and estrone. Estradiol is your principal estrogen. It's the estrogen made in the ovaries, and this is the estrogen we're talking about that we use for the first half of our life up until menopause. So its purpose cannot be understated. We don't have time to dive into all the ways that estradiol is necessary, but these are the most important ones, the ones I have up on the screen. So we have neuroprotection. Estradiol is there to help with our immune system and also protect against brain cell damage. It's also key in cell growth, repair, and connection. This is cell growth throughout the body, but specifically also inside of the brain. Brain plasticity, it boosts our ability for the brain to adapt and to communicate with one another. Estradiol also is heavily affected on our mood, specifically with our serotonin levels. It protects us in forms of oxidative stress of the brain and supporting, once again, our immune system. Our cardiovascular health is also very much closely tied to our estradiol levels, including blood pressure and circulation. And then our energy levels as well. Specifically, our partnership with glucose is very tied with our estrogen levels. And once again, so estradiol, this is what we use up until we start going through menopause. Estradiol is the estrogen of pregnancy. So unless you've had a baby or are pregnant, estradiol is basically, estradiol is basically non-existent within your body. So it's only present during pregnancies, and then after that, it's nearly undetectable. And then estrone, this is your estrogen of maturity, as I like to call it. It is the estrogen our body uses once we've hit menopause. It does have a weaker effect than estradiol and is made and found in fat-rich adipose tissues, right? So remember, estradiol is made in the ovaries, which is why when we go through menopause, we go through this huge transition. Estrone, which becomes our leading estrogen in our body, is made in adipose fat. And so if you think about it, you think about that weight gain that a lot of women complain about as they go through the menopause transition. A lot of that weight gain has to do with your body trying to use that estrone in that adipose fat. And so that can result in some weight gain and fat gain inside your body during that time. Okay, so like I said, we don't have a ton of time to go into great depth, but it's really important that we understand how estrogen affects all of the symptoms in our body or systems in our body. So when we're talking about it, there's two main systems. We have the endocrine system. That's what you're seeing at the very top of the screen, the female endocrine system. The clinical name for this system is actually the hypothalamic pituitary gonadal axis. The ovaries, aka the gonads, are so strongly wired together with this system that it's included in the name. But of course, it doesn't stop there, right? The receptors in our brain also are very tied to estrogen, and that's highlighted in that lower picture. And so I just want to point out some very key things because they are what affect our symptoms the most. So the hypothalamus is our body's homeostasis center. It is what monitors our entire nervous system and ensures our body temperature, our sleep, appetite, and blood pressure are all regulated. The pancreas is the liaison that acts between our hormones and our digestive systems, and this is where insulin is produced. So there's a reason why we see increased metabolical disorders during the menopause years, and it has to do, once again, with this estrogen and how our pancreas reacts to it. The hippocampus is where your memories are created and stored. The amygdala regulates emotional response. The prefrontal cortex helps with executive functioning. And then, of course, all the other ones that you can see on the screen that are listed, and they all play a huge part in our day-to-day functioning. And none of them function optimally without adequate amounts of estrogen. And so when we start going through menopause and our estradiol starts to fluctuate, what happens is that basically puts a tailspin of our whole body's system, right? Everything that works well because of estrogen is now having huge fluctuations. And because of that, we have all of these symptoms. So what do these fluctuations look like? She spends a couple chapters specifically talking about the 3 Ps. And the 3 Ps are your puberty, pregnancy, and perimenopause. And I know we're all here to discuss menopause, and I promise that when we learn about how our bodies and our brains interact, it can make that conversation that we're going to have in the next couple weeks about treatment and management so much easier. It'll help you know which treatment and which method you want to use to manage your symptoms. So we know that our brains and our bodies go through significant changes throughout our life, and menopause is no different. So we can look to the past to see how our bodies may or may not react as we're hitting that menopause stage. So we're going to do a little history lesson about the changes that occur within our bodies as those with an XX brain. So when we are born, we have between 80 to 100 billion nerve cells, and we quickly begin to make neural connections at a rate of 2 million per second, which is quite fast, and our brain quickly doubles in volume. This impressive growth begins to slow down by age 6 or 7, which is when we've reached about 90% of our brain's total mass volume. But as our brain begins to slow this impressive growth, it also begins a process of refinement and reduction as we use life's experience and the world and environment around us to prune those connections. For example, once you hit that 7 or 8 years of age, right, you don't need to think through every single step on how to tie your shoes. That just becomes automated. And so your brain kind of dumps out all the step by steps and just automates that process. So it's pruning those neural connections while still allowing our brain to grow and change. And that's where our brain plasticity comes into play. And so the first big change after that age 6 or 7 that comes is puberty. And puberty is when our hormones really become unlocked and come into play. So I know that most of us can probably remember all the lovely joys of going through puberty with all the physical manifestations of gangly limbs, awkward curves, pimply faces, and the introduction to our monthly cycle. But puberty is also a time where our brain is making massive changes as well. So during puberty, this might come as a shock, but our brain actually shrinks because once again, it's doing that pruning and downsizing. The phrase work smarter, not harder is exactly the brain's mantra. And that means consolidating and automating certain responses. But this process, I'm sure if any of you have teenagers of your own, know that this is not as straightforward as a process as it sounds. When it comes to brain maturation, it takes time and it doesn't happen in equal measure. For example, typically the hippocampus and amygdala, which once again, remember, those are in charge of memory and emotion, they get kicked into high gear first. So that's going to explain all of our lovely middle school and high school mood swings and fluctuations there. The prefrontal cortex, which is in charge of self-control and executive functioning, that's still under construction and takes well into our early 20s to finalize in growth. On top of the changes that are happening in literally the structure of the brain is also learning how to deal with our new estrogen fluctuations of our monthly cycle. These fluctuations become part of our brain's norm and adjustments from this point on. But while it's adjusting, it does have a lot of the same symptoms, right? So we can experience changes in body temperature and mood and sleep pattern and libido and memory and attention and brain energy and brain connectivity. That all happens in puberty as well. For most of us, that probably happened between ages 12 and 15, a lot of these major changes. So we might not remember. But once again, if you have teenagers, think about how smelly they can get, or their massive mood swings, or their inability to sleep, or going to sleep way too late. All of that has to do with our brain changing and having to learn how to deal with these fluctuations that are going on. And then it kind of settles, and our brain learns to work with our monthly cycle. So, for example, every woman who has a cycle has a little microcycles within their brain. So if you can think about either in the past or your current monthly cycle, basically the first part of your cycle is when estradiol is running really high. So your brain cells are literally visibly sprouting and growing new connections. The amygdala and hippocampus grow and their connections with the prefrontal cortex strengthens. This helps us feel more energized. We get better sleep. We have better stress management. We can feel more focused and more social and more communicative during the first few weeks or first couple weeks of the month. But then estradiol recedes and some of those connections also recede, which is why during the last half of the month, we can see mood swings and irritability and headaches and fatigues, and all of that just sets in. And a lot of these symptoms, if not all of them, right, all start with the brain. And so puberty is our first big download and readjustment that our brain goes through. The second one is pregnancy. So if you've ever experienced pregnancy, that's a good indicator as well of kind of some of your symptoms that you could be expecting when you hit menopause. The adult female brain comes with particular gifts, especially its ability to recall specific verbal information, as well as a strong episodic memory, meaning the ability to recall details of what, where, and when specific things happen and what are said. This is your proof that there truly is scientific evidence of why women perfectly recall a conversation that happened with their partner, and yet their husband or boyfriend or man in their life swears it never happened. There's actual a scientific reason for that. But all joking aside, the female adult brain is incredible in its connections and especially in its plasticity during pregnancy. Just like during puberty, when a woman experiences pregnancy, the hormones in her body once again begin to fluctuate and changing. And this change results in a massive new upload again to the brain and bodily sensations. This upload functions a lot of the similar ways as puberty, with the brain carefully consolidating and automating responses. If you've ever heard of the phrase mom brain, it's very real. Your brain is literally offloading what they deem as unimportant information, such as high school algebra or how to connect simple sentences. And because of this, your brain once again shrinks for a time, the same way it did during puberty, to make space for new uploads and growth. And this growth is seen specifically in the cases of the hippocampus and amygdala. The amygdala, once again, is responsible for our emotions. And so this is where our love and affection also grows for children, but it's also what generates the parental impulses to feed, nurture, and protect. But this upload can come at a cost, and it often comes at a cost that we remember much more than our puberty upload does. So we can have night sweats and hot flashes that we talk about during menopause. This can also be experienced during pregnancy and postpartum. The lack of sleep and fluctuating moods directly correlate right with those hormonal changes in the brain. The postpartum blues, depression, mom rage, the brain fog, the slip in focus and concentration, all of those are correlated to these changes occurring in your brain. And so if you're past the small people stage in your life, you know that most of those very frustrating changes eventually rebound and we return to our pre-pregnancy state. That's important to remember because when we're talking about the symptoms of menopause, it can feel like they're going to last forever. But just like with puberty, our brains rebounded, we were able to hit a better homeostasis. The same with pregnancy. After those, first few years with little kids when our brain needed to focus on something else, we eventually rebounded to that pre-pregnancy state and we're able to get our cognitive functioning back to the way that it was. And so that's what I have up here on the screen, right? It's just showing you how they all connect. And so with that, I want to prime us for our conversation for next week. I had sent out a survey along when we set out the registration for this class with questions. And I got a lot of questions about different symptoms. So I'm going to talk about the top symptoms that were mentioned that people wanted some more information about. So before that, I just think this quote is so important to remember that the health of the ovaries is linked to the health of the brain, and the health of the brain is linked to the health of the ovaries. And they're so interconnected. So when we see that, when we're making a massive change because our ovaries are no longer producing estrogen, that's where it can feel like we're really struggling. Okay, the first symptom that people asked and wanted more information about were hot flashes. This is typically and commonly the number one complaint when it comes to women in menopause. And hot flashes is probably not the best descriptor since these episodes can last anywhere from a few minutes to an hour. They are uncomfortable and they are frustrating, especially at night when hot flashes turn into night sweats and you wake up in the middle of the night drenched in sweat and having soaked through your clothes and your blanket. It can feel frustrating and it can feel isolating. And the good and bad news is that you're in good company. 85% of women will experience hot flashes, and while some are luckier than others with them being minor and feeling merely like an occasional inconvenience, others will just simply not be so lucky. The main reason you're experiencing these hot flashes have to do with your hypothalamus. So remember, the hypothalamus is the homeostasis center of the brain. So remember, it controls your body temperature, your sleep patterns, your appetite, and your blood pressure. And the hypothalamus is one of the biggest structures that are affected by the loss of estradiol. So when we talk about symptoms, a lot of them really can be traced back to the hypothalamus. And so when we have that transition, once again, we really feel that effect. And so because we know what the cause is, and now we know that you're not alone and this is a big issue, there are for sure therapies and medications that you can try that can work with these symptoms. We're not going to go into depth with those right now because that is what next week's entire presentation will be about. We are going to go over all the different types of hormonal replacement therapies, and then we're also going to go over non-hormonal replacement therapies. So I know we're talking about symptoms, and I know that as we go through these symptoms, people are going to want the solutions right now, but there's so many different solutions, and not every solution will work for every person. So I'd rather be able to have an entire presentation that walks you through the different options so that you can pick the best one for you. So hot flashes, that's kind of how it's caused, who experiences it, and why. The next one that I got a lot of questions on was just the emotional roller coaster that happens during menopause. So 20% of women experience or report experiencing mood swings. However, the big word there is report because there's just no way that the percentage isn't much more higher than that. Mood swings are very typical as a part of a woman's monthly cycle. And so because of that, those changes can easily get ignored, sidelined, or pushed down, even though our emotions are heightened more than what they typically are. So once again, you're in very good company when it comes to the emotional roller coaster, especially with issues like irritability, anxiety, the diminished ability to deal with everyday life hassles. She talks about this quite a bit in the book because this isn't necessarily depression. It's just simply feeling like you don't know how to move to the next item on our daily checklist. There's that lack of motivation, difficulty concentrating, overwhelm, new onset of panic attacks, rage. Rage is one that several of you brought up, as well as she brings up in the book, the rage that we suddenly can feel that comes on really, really fast and maybe doesn't make sense. If you were someone who did have a pregnancy and experienced rage postpartum, chances are you're more likely to feel that rage during your menopause transition. And then, of course, depression. So the causes for these emotional roller coasters, it has to do with the amygdala and the prefrontal cortex and the changes that they're experiencing by no longer having estradiol in the driver's seat. And no worries, yes, there are ways that we can manage these symptoms. And once again, we'll talk about those next week. Okay, sleep. Elusive sleep. Sleep is also affected by our hypothalamus. Once again, the hypothalamus regulates our sleep patterns, but there's also so much more that goes into sleep, right? If you're experiencing night sweats, once again, caused by the hypothalamus, or you're experiencing those emotional loop-de-loops influenced by the amygdala, that is not going to help your sleep patterns whatsoever. And so over a third of perimenopausal women report that they have trouble falling asleep and staying asleep. But another thing that she brings up in the book is that what a lot of women don't know is that sleep apnea is actually a huge issue among women. So sleep apnea is a chronic breathing disorder that stops someone from breathing repeatedly mid-sleep, which in result wakes them up. The National Sleep Foundation believes that sleep apnea affects more than 20% of the general population. However, of that 20%, 85% of people do not know that they have sleep apnea, and the majority of those people are women. Women are more likely to chalk up their lack of sleep due to stress, daytime fatigue, overworking, menopause, and just, our overall struggles from day to day. And because of that, we tend to push sleep to the side and don't view it as a symptom worth exploring. But if you're struggling with your sleep, it's going to affect everything else. Not getting enough sleep also will affect your hot flashes. It will also affect your brain fog. It'll affect your stress levels and your emotions. And so getting enough sleep is super important. And so if the different medications that we'll talk about next week, or therapies that we'll talk about next week, or the lifestyle changes we'll talk about in 2 weeks, if those aren't working, you might want to consider a sleep study to determine if there's sleep apnea or something else at play. Okay, and then the last symptom people wanted more information on was brain fog. So brain fog is last, but it's certainly not least, because over 60% of all peri and postmenopausal women experience and struggle with brain fog, and it tends to be the symptom that gets pushed aside the most often, and it's super frustrating. When you wake up and you feel like your brain is abandoning you, it's easy to get frustrated, it's easy to get scared. And many people who experience brain fog worry that they're experiencing the early signs of dementia, and that dementia is now an inevitable part of their future. And this fear is valid, but I also want to ease some of your fears. There is a large amount of research and a large amount of growing research showing that this change in your brain is temporary. So that brain fog that you're experiencing that affects your memory, it is temporary. Research shows that typically after menopause, our brain recuperates its mental acuity. In fact, to ease your mind even more, during the menopause transition, women still typically outperform men on the exact same cognitive tests that measure memory, fluency, and some forms of attention. And this is true both before and after menopause. So once again, on average, typically, your brain is going to recuperate back, and that brain fog is temporary. However, there is a caveat here, right? Anytime the word typically or average is used, it hides the reality that this is not true for all. We know that 2/3 of all Alzheimer's patients are women. And so there is fear there, and there is valid fear there, because in reality, some women experience no changes to their brain and their brain cognitivity during menopause, and some only have mild changes, and some have really severe changes. And that can lead to more cognitive issues. So, with that being said, if your cognitive issues are negatively affecting your daily life, and you've tried different treatments, different medications, lifestyle changes, all of which we'll discuss over the next 2 weeks, and you're not seeing any improvements, don't let your concerns be brushed aside by your caretakers. There are neurologists, there are neuropsychologists that are trained to help see, find, and catch cognitive issues early on. And there are ways that we can prevent the decline of our brain function. And we're going to talk a lot about that in 2 weeks. So our last section, we'll talk about how we can make sure that we are eating for our brains, that we're eating for our estrogen levels, and that we are really working to make sure that brain fog is not something that sticks around. So don't be afraid to seek out additional help. if only for your peace of mind. Okay, so before we end, let's talk about some good news, because menopause is not all bad. And I know that we just spent 44 minutes talking about the worst of it. So while it is true that most women grow unhappy in the 3 years leading up to menopause, and that satisfaction remains low for 2 to 3 years after the final menstrual period, over 60% of women report feeling happier with increased patience, less tension, and less withdrawn than they did before they ever started the menopause journey. So there's hope. There's a good reason to look at menopause as not an ending, but as a renewal, as a start. Most women find that after menopause, they have a renewed drive to ponder new experiences, to start new beginnings, to maybe start a new career or look for new relationships. A lot of women report wanting to go to new places to see and travel. There's also a huge renewal of health and self-care practices that happen in the majority of women. And so, once again, we don't need to feel like menopause results in the end of life and that we're just on that trajectory towards death. Instead, we should look at it as a new start and a new beginning to the rest of our life. The end of the ovary estrogen production and the shift in brain and the new upload that we receive during menopause results in a lot of, once again, right, new connections inside of our brain. So most women, and there's been imaging and studies shown that women have the newfound ability to draw better boundaries after menopause. They tend to feel more joyful connections. And in fact, most women report that sadness and anger has less of a hold of them. So while they still feel these emotions, our brain's ability to move on and instead hold a higher capacity for joy, wonder, and gratitude increases. This shift in emotions also results in a shift in greater empathy, but specifically improved form of empathy called cognitive empathy, where women are able to understand feelings on an intellectual level, basically understanding, right, why someone is feeling what they are feeling rather than simply what they are feeling. And so, as we talk about all of the negative things and symptoms that can occur, I hope you see that there is still reason to hope, and that menopause does not last the rest of your life in its symptoms, and instead can offer a new beginning. So I do want to be mindful of your time. I told you 45 minutes. I went 2 minutes over. So you are welcome to throw some questions in the chat. I'm going to stay on for a while. But next week, we are going to dive into both hormonal and non-hormonal medications and treatment. And I know many of you might have questions about these on how to manage specific symptoms. My goal is to address those. To help me address those, there is a QR code on the screen. Brittany also threw the link in the chat, but you can go on and you can ask your specific questions. They are anonymous. If you want to give me your name for me to respond to you directly, there's a space for that. But you can just ask your questions anonymously, and that will make sure that I hit those medications and treatments that you're the most curious about. And then once again, week 3 is going to be all about lifestyle and integrative health rather than specific medications. So if you've not signed up for the next 2 presentations, make sure you do now. The links are in the chat. And if you can't make those presentations, still sign up, and I'm going to send the recording of those presentations directly to you. So I know we're out of time. If anyone has any questions about the information we discussed here today, feel free to throw them in the chat or unmute yourself. Like I said, I'll stay on for a little bit. But thank you.
Looks like you have a question in the chat that's asking, how long does menopause last for?
Yeah, that's a great question. So I'm actually going to pull us back a couple slides. Give me just a second. So when we talk about how long menopause lasts, that really depends on symptoms, right? Because when we're talking about menopause, we're usually talking about the symptoms of menopause. And so the onset of menopause usually happens between 49 and 53. But the symptoms can start anywhere from 3 to 4 years before that on average. And then typically you can have some symptoms continue for about 2 to 3 years after this. So it can range anywhere from about 3 to 5 or 6 years is kind of how long those symptoms last the longest. But menopause in and of itself is technically considered basically just a year, right? It's that from that last period, 12 months after it, and that's how you know for sure that you're done with menopause. But the symptoms can last 6 to 7 years. Does that answer your question?
Yeah, it looks like that does.
Perfect. Any other questions?
We just have several questions asking about this recording and where it's going to be published. So just want to clarify that yes, Kirsten is recording and it will be posted on our workshops and events page on our website. Give us, a little hour or two to get that popped up on there, and then we can send that out to everyone that attended today as well in an email. That's great. And Belen, it looks like has a question. Go ahead, Belen.
Hello. So is it true that you kind of go based off your mom or like your family of when to start menopause?
Yeah.
How like
So
it's gonna be? Because my mom's has
yes.
been horrible and I'm like, no, I don't want that.
Yes. So it's a yes and no answer. Your mom's age that she started menopause is typically a pretty good indicator of the age that you'll start menopause. However, there's lots of ways to mitigate the symptoms. So if your mom's symptoms have been really, really awful, there are ways through lifestyle that can help mitigate those way more than we give them credit for. And so we will talk about that. The whole 45 minutes in 2 weeks will be dedicated to the certain lifestyle changes that we can make that help mitigate those symptoms without having to use medication if we're not interested in that. So
So like kind of
the
like
other,
thing,
yeah, like
like
it's a positive
prevention.
and a not. Yes, there are some things that while we can't prevent menopause, right? All of us are going to go through it. We
Right, like
can
the
help,
symptoms, right?
yeah, we can help mitigate some of those stressors that make it harder for our bodies to cope.
Thank you.
Yeah.
And I just put in the link in the chat again, Belen, for you to sign up for the next 2 sessions if you're interested, or the third one for lifestyle. But they build upon each other. And I swear it'll be
Yes.
great, just like today.
And
It looks
no,
like
Rebecca, you are not crazy. It's not early onset dementia. It's not mini strokes. Most likely it is just the lovely symptoms of menopause. All right. Any other questions? Okay. Well, like I said, if you have questions, throw them in that survey. I can make sure that we try and answer them over the next 2 weeks. We're also available for health coaching if you'd like some more one-on-one. Once again, I'm not a professional in this field, but I have done a lot of research and I'm happy to answer any questions that you may have. It's a topic much needed.